Hello and welcome back. It's important to hydrate well when you're working out. A good suggestion pre-workout is to have 250 to 500 mils of liquid, depending on how thirsty you are. But it's a good idea to start out your day with proper hydration. A glass of water is a great way to start. During your workouts, you need to replace about 60 to 80% of your sweat losses. Some people sweat a lot, some people sweat a little bit. Typical sweat losses are about 500 to 800 mils an hour. Some people can lose though up to about 2 liters an hour. If you're a high sweat person, you'll know it, and then you should drink more. Try to avoid losing more than 2% of your body weight. So if you're concerned, weigh yourself before a workout, weigh yourself after a workout, and determine how much weight was lost during that workout. You can calculate then how much liquid you need to replace that weight loss. For example, for every 1 pound of weight that is lost, you need about 3/4 of a liter for liquids to recover after that workout. Yeah, here's some looks at typical sweat losses. A baseball player is losing about just under a liter an hour. A soccer player closer to a liter an hour. Basketball, the same. Some endurance sports, particularly in the heat, will lose even higher, have even higher sweat rates. In American football, in all of the gear, all those pads, because of the high temperatures that are generated in there, can lose 1.5 liters every hour. Very high sweat rates. Along with those sweat losses come losses of electrolytes. You will lose calcium and magnesium, you can lose potassium, you will lose sodium, and that depends on the temperature. Most important is to replace those sodium losses. So if you are losing salt during long workouts over an hour, you will want to replace that salt with about around 800 milligrams of salt each hour. So that would mean that your drink during your workouts should have some electrolytes. If you're working out at a very high rate of exercise and your workout is going to be longer than 1 hour, you should also incorporate carbohydrate into your workouts, up to about 60 grams of carbohydrates per hour. In terms of rehydration, this is a little bit of a surprise to many people. Water is a very good choice, but you'll notice that there's some other choices here that after your workout will help you rehydrate quicker. Things like milk are actually very good for rehydration. And an excellent choice to refuel and rehydrate for athletes is something like chocolate milk. Now, if you're lactose intolerant, obviously chocolate milk is not a really good choice, but there are soy chocolate milks as well, work just fantastically. And they'll improve your hydration status very rapidly. Remember, after workouts, it's important to replenish your muscle glycogen. If you've been working out for an hour or more, replacing muscle glycogen is your first priority before you think about getting protein intakes. You need to replace that muscle glycogen, and that can be done by ingesting 1 to 1.2 grams of carbohydrate per kilogram of body weight. So divide your weight in pounds by 2.2 to find your weight in kilograms, and multiply that by 1 to find out how many grams of carbohydrates you need to recover from an intensive workout of an hour to 2 hours. Again, drink 1.5 times your weight loss in terms of pounds to liters, and try to add antioxidant foods, particularly fruits and vegetables, after workouts. The antioxidants will reduce muscle damage and help you recover faster. In terms of protein intakes, this is where a lot of students over ingest protein after workouts. Studies are very conclusive on this. There is really no advantage to ingesting more than about 20 grams of protein after a hard workout. It is far better to get that carbohydrate back into your system so you can work out hard the next day rather than overdo protein intake. So 20 grams, maybe up to 30 grams of protein if you're doing an extremely hard weight training session. For those who are trying to maximize muscle gains, athletes trying to maximize muscle gains, or people working out to maximize muscle gains, sleep is a really important factor. Sleep is the time when your muscles repair. During sleep, it is a good idea to provide your muscles with the protein and carbohydrates they need to repair properly. It's been shown that during resistance training, that's weight training, if you ingest 28 grams of protein with 15 grams of carbohydrate, maybe in the form of a smoothie or a hot chocolate drink or something like that, you can improve muscle mass gains. So I highly recommend some form of protein containing carbohydrate containing drink before sleep for muscle gains. Okay, are there supplements that are useful? The Australian Sports Institute has investigated the reports, the scientific reports of supplements and whether they are safe. These are some supplements that can be considered and are considered safe. Caffeine in the range of 100 to 200 milligrams, not more, can increase and enhance endurance, alertness, and can reduce fatigue. Creatine in the amount of 3 to 5 grams per day will enhance intense activities, things like weight training or weightlifting. Sodium bicarbonate is safe to use and can improve performance for events lasting in a sort of 3 to 5 minute range, but it is very difficult to use and makes many people sick. Beet juice again is something that works for some people but not for others. If it is ingested in about 0.5 liters per day, can improve oxygen delivery to muscles and improve exercise endurance. And then beta-alanine, 2 to 6 grams per day, taken as a divided dose, does improve some weight training activities for some athletes, not all. Definitely want to avoid steroids and steroid precursors. First of all, they're banned by the World Anti-Doping Association. Secondly, the supplements that are available are frequently contaminated with other chemical compounds that are dangerous to your health. They're used to try to increase muscle mass, but there are side effects, including hair, body growth, increased risk of pancreatic cancers, and in some cases, short temper, and difficulty managing anger and other emotions. Human growth hormone is another supplement that should be avoided. Does cause structural changes to the face, high blood pressure, and congestive heart failure. So you've been working out, everything's going great, but unfortunately you've got an injury. In the past, that injury would be treated using the following method: rest, ice, compression, and elevation. The acronym for that is RICE. That process is now really only supported for the first 24 hours of an injury. After 24 hours, returning to play is the most important aspect of recovery. And the new acronym is METH, which stands for Move It. Once the first 24 hours of rest, ice, compression, elevation has been completed and the inflammation and swelling is going down for the injury, it is best to start retaining functional movement of the joint. When you're not using it, elevate it. And it is important to stretch out the affected area, again, to maintain that functional fitness, that functional movement. And lastly, adding heat. Heat improves blood flow. Blood flow improves the speed at which the healing process will happen, and then slowly return to play when pain has subsided.